Hello, this is Dr. Jay Shore, Director of Telemedicine Programming for the Department of Psychiatry. This is part of the COVID tutorials for telemedicine, telepsychiatry. And this section will be briefly reviewing a few technical considerations when doing telemedicine. So, here in the Department of Psychiatry, we have really two major pathways that can be used for conducting video conferencing. So one is many of our clinics have been set up formally through the University of Colorado Hospital's telehealth team to run direct in-home telehealth clinics. And this is through Epic. It's through an Epic scheduling and workflow, and it's associated with video. And there's an appendix in the telehealth guidance that has a lot of links and resources about how to use and manage video within the Epic context. The other pathway is to use Zoom. This is the Zoom I'm using right now. We all have access to it. It is a HIPAA secure Zoom. You can find an appendix on that. And so you can use a Zoom video conferencing and overlay it on top of Epic or any other EHR, of course. And then using the telehealth guidance, you adapt it to your clinic workflow. Zoom can also be used as backup if video has technical issues. It's important that you use Zoom and video in a HIPAA compliant manner. They are encrypted and they're considered HIPAA compliant video conferencing, but that HIPAA is more a journey than a destination, right? And it's not just about the video conferencing system, but how you use it in your workflow. So for example, for Zoom, you can request and have your own Zoom room as a provider, and it's the same number for each session. You really don't want to do that, because if you give that that same number out to multiple patients, you create the possibility that two patients may join a session at the same time. Again, if you look at the appendix, there's references to CU websites that gives more detailed instructions, but they're fairly straightforward in my opinion. Easy to use and stable at low bandwidths, and particularly Zoom. Following up on HIPAA, we have gotten a mandate again as of March 17th, not a mandate, but a ruling from the federal government that says that we can use non-HIPAA compliant software such as FaceTime or Skype during the COVID national public health emergency to see patients. Now, if you look right there on the PowerPoint, it says, it says the Office for Civil Rights will exercise enforcement discretion. So they have not completely waived this out of compliance. Again, I think we're all saying in this situation that let's do what's in the best interest of the patient we're working with, but let's continue to have good standards and quality of care. So my strong recommendation and guidance for the department is to use video and Zoom as a first option. If either of those fails because of technical reason, I would try the other. As a second line, I do think based on this, we could move forward to use FaceTime or Skype to see a patient, either because of a technical issue or for some reason the patient's unable to get on Zoom or video. But let's use that as a second line measure, and use at the very least Zoom as our default unless we are in a University of Colorado University of Colorado Hospital clinic. The other thing I want to talk about right now is sort of the guidance that you're receiving here is really about using the video conferencing with patients. There's a big difference between doing video conferencing with a patient and completely working in a virtual clinic. And we are doing both. And so to have our clinics go completely virtual, there needs, in addition to what's offered in this guidance, a whole set of coordination around scheduling and communication with administrative, non-clinical staff, and communication between clinical staff. That often, as you go to a virtual clinic, you have to work to get those types of interactions, rather than if I'm just video conferencing in a clinic, I'm interacting with my administrative staff and my colleagues in person. And so I just like to point that out. There are resources, including our department's administration, that can help with this larger work and lift of virtualizing a clinic. But just to be clear that what we're talking about in these tutorials is really focused on the video conferencing towards the patient and not the wider task of clinic virtualization. And so I'm going to pause here. And if you're interested in hearing about the overview of the clinical considerations, then that is what the next video will be.